Today I have with me Sarah Russell, who is a public health researcher who I connected with on Twitter, which we'll talk about shortly. Welcome, Sarah. Thank you for joining us.
Thank you for having me.
So perhaps you could just tell us a little bit about your background, because you're a researcher, correct?
That's correct. I did a PhD in public health and got very involved in mental illness research for a long time. And more recently, I had parents in an aged care home, a very good aged care home, who they were treated with love and dignity and respect. So all the things you want your parents to be treated with when they're in an aged care home. However, with my public health lens, I could see systemic issues, problems. So I started shooting off letters to the aged. I used to walk my dog in the morning with a thought bubble, and they started publishing these letters. And very soon after that, I was asked to write opinion pieces. And I've just published my 67th opinion piece. And I feel like I am a stuck record. But I still participate in I moved myself onto Twitter about 2 years ago because my local MP said, that's where you need to be. I don't quite know why, but it is the fact that there's a lot happening on Twitter, including meeting you. So there's a lot of issues in aged care the Royal Commission tried to address, but they're still where we are. So that's what we're here to talk about.
Well, I was thrilled to connect with you because you started sharing with me really valuable information, as you know, and I thought, oh, I feel as though I've been hiding under a rock. For those listeners that are aware, my mum and dad were both diagnosed with COVID in an aged care facility at the very beginning of the outbreak in Sydney, New South Wales, which is a pretty torrid time for any family member, but it was because of an unvaccinated worker. But when I spoke up, it seemed to be the beginning of, hang on, we thought aged care workers were meant to be vaccinated way back in April, and they haven't been, and the media went crazy. So what I've learned, particularly from you, Sarah, is just how bad the aged care system is. And despite a Royal Commission, we don't seem to be going anywhere, and they seem to be talking in a vacuum. No one wants to know why.
Well, it's very interesting, Kathie. Once you get involved with this sector, you can't look away. So that's probably like your destiny now. You're going to have your eyes on this sector, like I have since my parents died. My mother died in 2015, and I'm still here. If you look at the history of aged care, things changed remarkably in 1997. There was a new Aged Care Act. Would you like me to talk briefly about why?
Yeah, that'd be great. Yes, yeah.
Well, the reason the Aged Care Act in 1997 was under the John Howard government, and they had realised that we're having an ageing population in Australia, surprise, surprise, and we don't have enough money, public money, to spend on aged care. So the smart Liberal government decided we need to encourage private investment into aged care. So we had an influx due to the Act. The Act actually was written primarily to encourage private investment into aged care. And that's where we are today. We have an Aged Care Act that is, it doesn't mention how much staff you need to have. It doesn't mention the training of the staff you need to have. So things have shifted incredibly. We now don't, some aged care homes do not have a registered nurse in them. Now that is surprising and quite shocking to people who just assume what used to be called nursing homes would have a registered nurse in them, but there's no legislation that requires it. So since 1997, there have been more than 20 inquiries into aged care. And these inquiries have come about mainly because of the media reporting horror stories, I call them, and they are horror stories. And each inquiry has really sensible recommendations, which are never adopted. And then a few years later, we have another inquiry, and then another inquiry. And eventually it got so bad that we had a Royal Commission. And the interesting thing about the Royal Commission is you'd hope that it would actually improve the sector. You'd hope it would all the light switches would go on. The best thing the Royal Commission did is it made the public aware of how poor the standards of care are in some aged care homes. And it made people aware that there were many distressed families out there, many distressed families. And it also did some really good research, which people forget about that. But the government, again, has not really adopted the recommendation. There are 148 recommendations, and the government's response to these recommendations has been largely to put more money into the sector. But the system is still fundamentally flawed until we get a new Aged Care Act that has a human rights perspective. So it's focused on the older person. And fortunately, that was the first recommendation of the Royal Commission, to get a new Aged Care Act. So yay, but let's wait till we see it happen. I mean, I'm just holding my breath and waiting for some genuine action after this Royal Commission. I cannot believe you spend $100 million and not actually change the system.
So that gets to a couple of points. First of all, I just want to clear up the confusion around semantics. So am I correct that nursing homes as a terminology is obsolete and it's now called an aged care home? Is that what we...
They actually call it an aged care facility. Now, one of my opinion pieces back 6 or 7 years ago, I just cannot bear to call them a facility. It dehumanises the place, in my view. So I insist on calling them an aged care home. And to be frank, my mother considered it her home. When we would go out for the day, she would say, "Oh, what time are we going home?" And that was to her aged care home. So I always call them an aged care home. But many people call them an aged care facility. And some people, particularly the old nurses who are often very appalled at the changes, insist on calling them a nursing home still. We could talk about the semantics all day, really, about the language and what they mean, but the official term in all the government documents is to call it a residential care is called an aged care facility, and the people who live in an aged care facility are a consumer. All the departmental language is around the consumer.
Yeah, okay. Which gets to the next comment regarding the perception that there's a nurse in every aged care facility, or your loved ones are looked after by nurses. Now, there is a huge misnomer around that. It's not true. Some have a registered nurse on duty, but many of them have personal attendants who can do a course in how long in order to be qualified?
Well, I used to be outraged that you could do a course in 5 weeks and be a personal care attendant. After COVID, some people were going into an aged care home after doing a 10-hour online course. So to me, that's appalling. The reality is, many personal care attendants are loving, they're compassionate, they're kind,
Absolutely.
they do their absolute best. The reason the registered nurse is so important, for many reasons the registered nurse is important, but one of the reasons they're so important is when there are clinical changes in a resident, a registered nurse will notice and will act. And hopefully that action will prevent that person, that older person, from being moved to hospital. So lots of admissions to hospital are preventable. If you think about what the major reasons people are sent to hospital from an aged care home, a registered nurse would have picked it up. I was a registered nurse back when I was between the ages of 20 and 28, I think. And, I've worked in an aged care home, which was called a nursing home when I worked there. And we noticed things because we were actually doing the showers and things as well. And you notice a lot when you're providing care to an older person. If you've been trained, a registered nurse has 3 years training, you notice clinical changes. and you can act very quickly, and it's very disruptive for people, like your parents being transferred to hospital. I'm sure that was confusing for them and disorienting. Traumatic. Yeah. And it happens all the time. And I could go into, I know this is more general, so I won't go into some of my conspiracy theories around why they're transferred to hospital, but a bit of it has been suggested it's cost shifting. And I could explain that if you want me to, just briefly.
Yeah.
The federal government funds aged care, residential aged care, or it funds home care as well, but we're talking residential care. State governments fund hospitals. So when, let's just say you're getting a subsidy from the federal government to look after your residents, but let's just say you decide not to spend it all on the residents and you put some of it into a sports car instead. It's just being really cynical. Then the resident gets sick because there's not a registered nurse on duty, and then they go to hospital to be treated, where the state government picks up the tab. So does that see how that's?
Yeah, so let's just talk about that in relation to COVID. So we have a situation in New South Wales, I'm not sure if it's the same in Victoria, where anyone testing COVID positive in an aged care facility is removed to hospital.
Yep.
Well, they were given, but our hospitals are now reaching capacity. So that will be interesting what happens. So they're removed to hospital. So you're saying that even between the two of them, the federal government says, you know, we're responsible for vaccinating workers, and state government says, oh, no, it's got nothing to do with that, it's the federal responsibility. But they're both in cahoots because of the removal.
Yeah, I'm not quite that cynical. I think I was very adamant back in Victoria when we had our second wave that a resident who tested positive should be transported to hospital. But we didn't do that. We did something called cohorting, and we tried to put the positive, because we had a lot of aged care positive patients. We had, as you probably know, 655 residents died of aged care. Of COVID in aged care. One of the things about aged care homes, going back to my initial point about the Aged Care Act and the private investment, is we have very large facilities. Some have 100 beds, 120 beds, 150. It spread like wildfire during our outbreak in Victoria. And the issue there was, what do you do when someone gets COVID? And they tried to contain them in a certain part of the aged care home. That's why it was called cohorting. But, it's your home. People with dementia might go for a walk down the corridor, and suddenly it was infecting a lot of people. So I was very keen for aged care residents who are positive to be sent to hospital. So for two reasons. One, they'd get proper medical care, and secondly, they wouldn't infect other residents. And I was hopeful with smaller numbers that would work in New South Wales. I was very pleased you were doing that in New South Wales. However, your numbers now are looking frightening, but to be perfectly frank, the numbers in aged care are not looking frightening. There's only, nothing like Victoria, because we didn't have a vaccine.
That's right, that's right.
So the vaccine, and many residents have been vaccinated. I think most of the residents have been vaccinated now, finally. It's the staff who haven't been vaccinated.
That's right. So let's talk about that, because there's a couple of things. I want to come back to the human rights aspect, but the staffing situation, and I think we both agree, certainly with Mum and Dad, there's some beautiful people that look after Mum and Dad, and I'm so grateful for how kind they are and how naturally suited they are to that profession.
Yes.
But they're gravely underpaid.
Yep.
And many of them are migrants or new migrants, and the working conditions, frankly, are not good. I've noticed we've got quite a good union movement beginning to spring up around the aged care sector. What are your thoughts on all of this? What is it going to take to turn it into a valued profession?
Well, I think the pay is a real issue. And we have tried to address that many times in the past. And there's a lovely paragraph in the Royal Commission report that states that we have given money specifically to improve the salaries of staff, and it hasn't been with the hope that it would be given to salaries, but it wasn't. I mean, it's so the remuneration for aged care staff, particularly the attendants, the PCAs, in Sydney you call them assistants in nursing, is appalling. They would get more money as a stocking shelves in a supermarket.
Absolutely.
So it's really appalling. The interesting thing about registered nurses that was pointed out to me only recently is many registered nurses in aged care homes are level 5, and they should be paid the same as as a level 5 in a public hospital, and some do. My mother's aged care home, they paid them very well actually, but they did. Not all aged care homes pay them the same as in a hospital. So you know, if you're raising a family and you need money, you go to where the money is. You go and work in a private hospital probably, as opposed to a private aged care home. So that needs to be addressed. I think, Kathie, I don't know if you agree with this, but I think a lot of the issues of aged care are underpinned by ageism. I think we are not valuing our older people in the same way that other countries do. And I can give examples of that, where older people, we could even look to our First Nations people and how just even by calling older people elders, and the respect shown to elders in our Indigenous population. We need to learn from that. We really do, because, you know, it's...
Look, yeah. I couldn't agree more. I mean, it's really interesting. My parents, and you probably understand, is you often don't see your parents as getting older. They're just people that you love.
Yes, that's right.
And you know, and life creeps up. All of a sudden, they're getting older and have other complex health conditions. But mum and dad are very cognitively engaged. They have underlying health conditions, and that's why they need aged care, because my mother made a decision that, look, it's time for us to go and get looked after. I can't do anymore. She didn't want to be a burden to my sister and I. But when I spoke to the media, and, you know, I was so angry. I just don't, you know, I just constructively using it. And I said, these people have been our prime ministers, our judges, our, you know, our teachers. What are we doing around respecting our elders? It's quite extraordinary how we have an attitude. We put them in these places, except the family, we shut the door and forget them. And I even noticed that with some activities, not all activities. I can assure you my parents don't want you to go and play corridor bingo. That's not their gig at all. They're very engaged. They want to have a book club or talking about, you know, those sorts of, but it comes down to ageism. You know, so entrenched in our society that we want to talk to them like children. Now, different people, we all age differently, and different people have different health conditions. What do you think it's going to take?
Well, look, you made quite a few really important points there. The first point you made is you talked about love. And the thing that people forget is people who are living in an aged care home are often someone's parent or partner, uncle or aunt, grandparent, and they are loved. And yes, some of the physical requirements have meant that they can't live at home anymore, or they couldn't get a home care package at a level high enough to sustain them at home. They couldn't get the care they need. That's another whole issue, the home care stuff, because a lot of the rotting that goes on in the home care space. But let's just focus on love. These people are loved. And what COVID did is it stopped people seeing the resident who they loved, and the residents seeing the people who they loved. And it was a terrible, terrible thing, because I've been arguing since March of last year that if someone with 5 weeks training can learn how to do infection control, so can a family member. If a family member visits every day to help with the meal, to help with the social activities. I mean, if your aged care home is only providing bingo, which I've done some research with relatives, and residents, and someone called bingo elder abuse, just as a joke, but, you know, but if you were requiring, like I was doing the age crossword with my mother every day. We're doing book club, we were doing knitting, we were doing activities that she enjoyed. And that was all taken away when we were all locked out. Or luckily my mother had, I say this honestly, luckily my mother had died, because every time I heard another terrible story about a family member who normally visited every day or every second day or even once a week, who was locked out, I just imagined my mother and how she would have been not seeing me or not seeing my brothers or not seeing her grandchildren, great-grandchildren. And it's just a devastating thing to have happened. So you talked about love, but you also talked about some older people feeling like they're a burden. It's a very common thing for an older person to say, I don't want to be a burden. Mm. But you don't hear 3-year-old children saying, I don't want to be a burden to my mum. I mean, we give so much to our children, and we give so much lovingly to our children because we want to. So can we please give that to our older people as well? Because many of us want to. But aged care homes sometimes prevent you from participating in the care as much as many families want to. And that really upsets me. And I try very hard to help families who want to be engaged with their, with the resident. So that's my response to what you said. Anyway.
Yeah, well, you made a really good point, and it's one that I talk about a lot, and it gets talked about as we need to learn hard skills. But you made a point about the most important soft skill in life, and that's love. Yes. Without love, there is no life. Like, we all survive and thrive on connection, on intimacy, on all of those things, and that wonderful bonded feeling of love. So I think those that operate in the aged care sector, particularly families, need to start using the word with pride. It's not something to be ashamed of. We love our families. And to us, they're not residents. They're our family.
Absolutely.
End of story.
Absolutely.
So I'd just like people to really get and be proud of the love that they feel for people that have been there for us, and it's now our turn.
Absolutely. Yeah. I remember at my mother's 90th birthday, my brother made a speech saying that, thanking me for putting my life on hold to go and visit my mother every day. And I had to interrupt his speech and say, I am not putting my life on hold. I am doing this with love, and I want to do this. And I actually had a really good time going to the aged care home. I enjoyed obviously spending time with my mother, but also spending time with the other residents' family. It was a very connected place. But interestingly, when one of the residents moved in, the not the manager, but the one up, what's that called? The regional director or whatever they're called. Actually, I know it gets all very hierarchical, like in most health things. But she actually said to the resident's daughter, "You only need to come in and visit once every 6 weeks." And the daughter said, "Oh no, I just live down the road. I'd like to come in every day and just pop in and see mum." And oh no, that will actually, prevent us doing our job properly. And when she told me this, I thought that's the opposite attitude you should be having. You should be having the attitude of welcoming families to work in partnership with staff. And so, interestingly, the Royal Commission did a special pandemic 3-day inquiry, and they wrote a report. And they actually made the observation that, during COVID, during the lockdowns in Victoria last year, there wasn't enough staff to provide the care that was required, because a lot of families do this care, and the families want to do this care. Not all families can, but some families can. Not surprisingly to your listeners, I'm sure mostly women, but nonetheless. Yes. It's a feminized, looking after children is mostly women, not so much. Hopefully that's changing. But my point is that aged care homes need to, particularly with, staffing levels being so inadequate, so they're so short-staffed. A family member who can provide social support, can help with the meal, can walk them to the toilet. This is just really helpful. And they should be encouraging that, in my view.
Well, I don't know of any other sector that has a really targeted major volunteer workforce in family members that would be very willing to do whatever training was required to support their loved ones in aged care facilities. I find it quite extraordinary that we haven't developed a really powerful, network of volunteers. And in fact, during COVID here in New South Wales, I haven't seen my parents for some time since they've come out of hospital. And I offered to go and do a course and said, I'll come in and help if you're short on staff, I'm fully vaccinated, what do you need? And the comment was, oh, we're still under observation and we're still under lockdown, which, and I thought, how sad.
It is really sad. It's so short-sighted of them. I mean, as I said, but, as I said, I'm repeating myself, I know, but if someone with 5 weeks training can learn how to do infection control, can learn how to, the problem was in Victoria, those people with 5 weeks training did an online 10-minute course learning how to put PPE on and take it off. Now, anyone who's a listener to your podcast will know that taking off PPE is really important. You do it properly, otherwise you're flicking the virus everywhere. So, and these people couldn't do it properly. But the stuff, and also in Victoria, again, this is a real issue, that because of the casualised workforce in aged care, a lot of people are only getting 4-hour shifts, or shifts during lunchtime, shifts during the peak periods, lunch and dinner and breakfast times, and they're getting short shifts. So they have to work in 2 or 3 aged care homes to get enough money to survive. And they, not doing their, and some of them were coming to work with a cold, with a runny nose, so they possibly had COVID, and in many cases they did have COVID. Whereas a relative, even with a slightly tickly throat, would not risk it on their loved one, so they wouldn't come in. And I just find it extraordinary that we've been locked out for such a long time. Even in states which haven't had COVID are still having restricted visiting hours. And look, I've written a piece for Christmas last year where, there's one facility wasn't allowed to have a Christmas tree because they were afraid of COVID. And you're just thinking, this has just become completely ridiculous.
Yeah, and I think the thing is, people in aged care, they are reaching the end of their lives. It is their last time. There won't be another. Yep. There won't be another home on this earth. That's it.
That's it. Yep.
And by isolating people from the people they love most,
yep,
we're causing all sorts of trauma that isn't necessary. And when you actually talk to those that in aged care, they will say to you, I'd rather see my family. Well,
and the other thing to say, particularly again, during the first wave, which is Australia-wide, I had many people contacting me saying, I'm much more worried that my mother or my father is going to die of neglect. Remember, the interim report of the Royal Commission was called neglect. So they were much more worried they were going to die of neglect than of COVID. And they were asking to come in. They were offering to do infection control courses. They were offering to do, they were going to come in and feed. It's very sad. They were really worried about their father might die of malnutrition and dehydration because he took about an hour to eat his meal and they used to help him. And he did. He died of malnutrition and dehydration because they just didn't have the staff to feed him. Yes, he was 100 years old, and yes, he was at the end of his life, but that isn't the way. That should not have happened. And I tried so hard to get that family to visit. And I'm talking a bit around the shops, I know, but in Victoria, we were allowed to leave home for a certain number of reasons. And one of those reasons was to provide care for an elderly person. So if an elderly person lived in their home, we were allowed to drive to their home outside our 5Ks, go to their home, provide care, but we weren't allowed to do that if they lived in an aged care home. So if they lived at home, we could do it, but we couldn't do it in an aged care home because, and I just want to finish this point, because aged care homes are private property. They are owned by the provider, and the provider makes the rules.
Yes, and that's the issue. You are trespassing, if you go onto their property without their permission.
Yes.
And they use it, some of the tough ones, because, and even in their language, dear family member, or this whole notion of you're outside of our area of operation. It's not inclusive. And family members need a seat at the decision-making table. I'm absolutely convinced of that. And we're not given an adequate role in all of the major inquiries, safety areas, all of those things.
Absolutely. And not just family, older people need to sit at the table.
Yes.
I mean, and older people need to sit at the table for the policy development for home care, for the policy development of residential care. One of the aged care homes that I did some research in, they actually put residents on their employment panels because it's their home, and this new worker is going to be working in their home, so they get a say in who works there. Now, that just to me is obvious. Of course you should do that. Of course the older people should be on the employment panels. We seem to think that because you live in an aged care home, you're less of a person. But these people need to be at the table, and they need. Richard Colbeck, Greg Hunt, the aged care minister, and the other one, I call Richard Colbeck the other one. They need to be listening to older people. They need to be listening to families. In fact, I've argued in many of my pieces that if they had listened to older people, to families, and to staff, some of these problems with COVID would not have happened. They would not have happened because the systemic failures that enabled all these problems to happen would have been acted upon years ago. They should have been acted upon years ago. But instead, as I said earlier in the beginning, we just seem to throw money at aged care. We keep throwing money into a failed system, and it's just not getting any better.
Yeah, absolutely. So I sort of want to move on to human rights, but I want to pick up on a point of what you said about, valuing older people, having them contribute as well as family members. And when I spoke out to the media, I was just anger. I was so upset that my parents were in that situation. But I had hundreds and hundreds and hundreds of emails and messages from people saying, thank you for speaking out. My mum or my dad or my aunt or my loved one died during Victoria COVID or wherever it might have been, and they didn't die from COVID, but they died of loneliness, and they were a victim of COVID, and all of this sort of language. But what was really interesting is when I spoke from the heart, I said it's just common sense. You don't put unvaccinated workers with aged care people. It's common sense. And that's the thing that you're talking to, of involving family members, involving older people, the elderly, because common sense seems to have gotten thrown out of this system, if you like, and we've institutionalized it far too far.
Yeah, I agree with everything you just said. The interesting thing was when the announcement was made in February about vaccinating residents and staff, we were told it would be done by Easter. We were and it's in writing, and how it would be done is in writing. It would be done by an in-reach vaccination workforce. Goodness knows why they didn't just use the GPs who give the flu vax. That would have been sensible to me. They managed to give every resident a flu vaccination, but they didn't use that. They instead spent $65 million on this vaccination workforce. Again, lots of money, and for some reason, staff dropped off. They weren't part of the deal. When I talked to the companies that were the workforce, they said, no, we were just contracted to inoculate residents. Staff were then given a fact sheet about where they need to go to get vaccinated. And it was really quite confusing for staff, and they didn't know what to do. They were getting the same messages we were all getting about, all the hesitancy, confusion. It was terrible. And I don't blame staff, because most staff want to get vaccinated.
Absolutely.
But if you're a casual worker, I don't know about anyone who's listening, but I had AstraZeneca, and I felt I could not have worked the day after my AstraZeneca shot.
I went to bed for 3 days.
Yeah, I went to bed for one, so you win. But I'm
glad I've got it.
Yeah, me too. But the other thing to say though is, that's a day's work for a casual worker.
That's right.
So, you know, why not give them some money to encourage them? This is, if you get vaccinated, you get 1 day's work paid for, like $300, which Albo suggested. That would have made such a difference to aged care workers. They could think, all right, I can go and get vaccinated. If I'm sick for 3 days, at least I've got some money coming in. Oh, it's just been, I'm very cross about this, because really and truly, this is it's a national disgrace that we did not prioritise aged care workers. Absolute disgrace.
Absolutely. And they should feel very upset.
They don't. Richard Colbeck was asked about it, and he was very happy with how the rollout was going. Very happy.
All right. Well, let's move on to human rights, because I really want to talk about that.
Good.
Now, I discovered separately, before you opened with it, really interesting. If you complain to the Australian Human Rights Commission about what's going on in an aged care facility, they will not take up the complaint, because the Act doesn't cover aged care facilities.
Yeah.
Isn't that interesting?
It's very.
It covers everyone else's rights, but not the elderly.
And it's very intentional. That is a very intentional omission. But look, there was so much pressure during the Royal Commission for human rights approach to aged care that it's the #1 recommendation. And the first recommendation is for a new Aged Care Act with a human rights perspective, putting the older person front and centre.
And what's the Human Rights Commission's feeling on this?
Very, very supportive. Human rights lawyers are very supportive of this, probably because I'm going to get some more work. But no, that was meant to be a joke. But the second thing that the Royal Commission recommended, and the government has accepted, is that there will be a council of elders on the committee designing the new Aged Care Act, and it will be done by, I think it's the 1st of July 2023. Now, we need to get cracking, because there is no council of elders that I know of yet. There's been no call out for our council. Anyway, but those two things are really good recommendations. And
yes.
Yeah, and but you know, I just gave a presentation on the Human Rights Act and an approach to aged care, and you know, there's a lot of people working in this space, and I think we can get a very good Aged Care Act if we just keep thinking older person front and centre.
So what's it going to take for people like you and me and anyone else listening to unite and march in one direction? Because everybody shouting out a lot of noise is not going to make them change. When I spoke about vaccination unintentionally, is why aren't they vaccinated? Yeah. And that was a very clear message in the media. That's where they were coming from. Yeah. What have we got to do to put human rights front and centre, and to have the Council of Elders, which is a fabulous idea? Yeah,
it was actually Leanne Briggs's idea. It's really interesting, and I could talk probably for too long about this topic, but it has amazed me. Just going back to my other work in mental illness, it was a very united advocacy space, I found. And we very early on got consumer consultants who were people with the lived experience on all the committees. It was quite unified. I find the aged care advocacy space very disunited. Everyone's shouting, and I think there's a few reasons for that, and these are all hypotheses of mine. I think many people who have a family member in an aged care home are traumatised by the experience. I think anyone who's had to deal with my aged care, who's had to deal with the Aged Care Quality and Safety Commission, which is the Complaints Commission, anyone who's made a complaint, they come to me and I feel like they've almost got PTSD. I mean that's an example. I call it aged care PTSD. And therefore that encourages a lot of shouting. So you see this on Twitter, you see a lot of shouting. And what we need is people with a calm head and a kind heart and an open mind, who's happy to sit at the table with the providers, with the bureaucrats, with the government, which I try to do, but I get criticised for doing that because I'm apparently talking to the enemy. Now, I don't see them as the enemy. I think we're all trying in our different ways to make this sector better. And if you don't talk, if you don't negotiate, if you don't sort of come to the sort of, I don't know, as I said, an open mind, kind heart helps you to, I mean, we can't get everything we want, but we can get a lot of what we want if we learn how to negotiate for it rather than scream for it. That's what I think anyway.
Well, I actually agree, because I've done quite a lot of work in domestic and family violence, and there are some amazing advocates, but there is a great deal of shouting that we need change and around safety of women. And as a consequence, in my view, it's my humble view, that the messages get very fragmented, and you need to keep the focus on baby steps. What are we going to achieve? What's next? What's next? So I think, you know, to wrap this up, what I'm hearing is we need loving family members to come to the table with love in their hearts, because that's what we bring, and it's a huge strength. We need to work together. We need to train. We need some advocacy training so that everybody can contribute, because there are people that are like yourself researching, there are people with other skills, but there are family members that have a lived experience that they want to share their story. And we need some trauma support, because I totally agree with what you're saying. Going through many of our systems in Australia is traumatising. They're based on colonial viewpoints that have had their use by date. And the world after COVID is going to be very different. People aren't going to tolerate other people interfering in their lives the way we've all had to isolate and live in these very insular worlds. So last comment, Sarah, what's next for you around aged care? What are you focusing on just in this moment?
Well, interestingly, I'm 6 years down the track of doing this. I stepped up earlier this year to form Aged Care Reform Now, and it fell over for reasons that I won't go into now. But so I've gone back to Aged Care Matters, which is my where I write. I still engage in debate. Community engagement and a grassroots movement requires foot soldiers. I don't like calling them soldiers so much, but so it's very hard to get people who are currently going through the aged care experience, by either family member or residents or home care recipients, because they're so exhausted. They're exhausted. They're trying to care for their elderly parent, their teenage children. They're trying to work full time. It's a really exhausting time of life. So actually getting people to come together is actually really hard. And I'm trying to, at the moment, you say, what's in it for me? All right, what's the next step for me? If I could just talk very personally, I believe our aged care minister has failed us. And fortunately, I'm in his electorate. So right now, I am working with a group of people called the Voices of the Mornington Peninsula, and we are trying to put up an independent candidate, a bit like Kathie McGowan, Zali Steger, and we are trying to get an independent to actually, who cares about aged care, who cares about climate change, who cares about domestic violence, these sort of real issues that we're trying to, that's what I'm doing. I'm trying to work with the Voices campaign to get an independent candidate and really hold this aged care minister to account for what has happened over the last few years.
Well, to wrap, I mean, I guess what I would say is our Prime Minister needs to take some responsibility, because the buck stops with him. And he has publicly said about his own experience with his own father, who passed away, I think it was last year or the year before.
At the beginning of the COVID, actually.
Yeah.
Passed away.
So he knows how many of us feel. He's alluded to it on numerous occasions, but he hasn't given the significance to aged care that needs to take place. So, Sarah, thank you for joining.
Can I make one quick retort to that? The aged care minister also had a father in aged care home, and so did the Prime Minister. They were, I mean, as the well-known public figures, their parents got the top-class aged care, didn't they? I mean, it does. So for them to compare their top-class experience with ours is with a normal run-of-your-mill aged care experience. It's just not fair, because they both talk about what wonderful care they got. And so that makes it, I get very irritated by that, because of course the aged care minister's father got the best care. Of course. That's my response to that. But I agree with you that Scott Morrison needs to take responsibility and be accountable, but he hasn't been for anything to date. Bush, nothing. So I'm not holding my breath for that, but
yeah,
let's hope so. But yeah.
So Sarah, I'm going to do what we've spoken about. I normally end these very differently, but I'm going to end with love in the spirit of this conversation. And I will say to anyone who has a family member, a mum, a dad, a aunt, or a relative, a friend in aged care, we love you, we care about you, and we're sending you all lots of virtual hugs during COVID. Thanks for joining us, Sarah.
My pleasure. Bye-bye.